Hi, my name is Jessica and I'm the Outpatient Total Joint Coordinator at Willamette Surgery Center. Due to the recent concerns in our community, I have put together this PowerPoint in place of the education class. Please feel free to call or email me with any questions. Thanks to your health and fitness, you qualify for this outpatient surgery, allowing you to heal in your own home. What better place to recover than your own bed? I will be with you throughout your journey, helping you navigate through this entire process, starting with preparing for your surgery by educating you and your coach on what you need to know to have a successful experience, from pre-op to your transition home. I will be calling to check on both you and your coach for at least the first 2 days after surgery, and again at 1 week to help remind you of a few things as you recover. We have an amazing program at Willamette Surgery Center. We are proud to say that we received the Joint Commission Advanced Certification in Total Hips and Total Knees. We are the first ambulatory surgery center in Oregon and fourth in the country to receive the certificate. We are held to the highest standard. We have state-of-the-art operating rooms and an amazing team ready to care for you. We have an outpatient total joint care line that you can call 24 hours a day, 7 days a week. We understand that this is not something you are doing every day, and you may not know what normal looks like. We don't want you sitting around and wondering. Please call our care line with any questions or concerns. We will have this number for you on the day of surgery. It's an answering service that will get your information and your number, and then someone will get back to you. You will receive all of your prescriptions at your pre-op appointment. I encourage you to get these filled about 2 weeks before your surgery. You will be given a prescription for pain medication that should last until your first 2-week follow-up appointment. Please remember, any questions or concerns regarding medications or your recovery should be directed to Hope. If you will be needing a refill on medication, please give Hope at least 2 days notice, and please remember that Hope cannot refill prescriptions on the weekends. Your coach will be a huge part of the success of your outpatient total joint surgery. I will work closely with both you and your coach to ensure you have an excellent experience. We want you to understand that you will always have a direct line of communication with either myself or Hope. Safety is always our top priority. We do require that your coach is with you 24 hours a day for the first several days after surgery. You will be walking before you ever leave the surgery center, but we do not want you getting up by yourself at all for at least the first 2 days after surgery. I will explain why this is so important throughout this class. Your coach will be with you for the education, transportation to and from the surgery center, as well as follow-up appointments. Most surgeons allow patients to drive at about 4 to 6 weeks after surgery. You should have received the Joint Replacement Patient Guidebook. Use this guide to help you prepare for your surgery and to keep track of important appointments. This class is taught in conjunction with the book to help you better understand what to expect throughout this process. I do encourage you to write down questions as you think of them so we can make sure all of those questions are answered before you go home on the day of your surgery. Again, if you think of questions, you can call me. Physical therapy plays an important role in the success of outpatient joint surgery. You will have one visit with your physical therapist before surgery to learn how to walk using your front-wheeled walker, the best way to get in and out of bed, bathroom and toilet transfers, the safest way to get in and out of your car, and post-operative exercises will be reviewed. We will review all of these things as we're doing them on the day of surgery, so it will not be brand new when you get home. Outpatient physical therapy should begin 3 to 5 days after your total knee replacement and a week after your total hip replacement. Home health care is all built into your surgery. You will not receive any separate bills for home health. We just feel better having a nurse lay their eyes on you for the first 2 days after your surgery. You will receive 2 nursing visits and 1 physical therapy visit after your surgery. The information will be provided in writing on the day of surgery, and they will call to arrange a time to visit. They do not just show up at your door. We are currently performing approximately 700,000 knee replacements annually in the U.S., and they are projecting that to increase to 3.48 million in the next 10 years. Over the years, knee replacement techniques and instrumentation have undergone countless improvements. The latest studies show that 85 to 90% of total joint replacements are lasting 25 years or longer. You are here because your joint is worn out. Most of the time, this is from arthritis. Unfortunately, this is hereditary and cannot be changed. It can also be from an old traumatic injury. Either way, your cartilage has worn out so severely that you need a total joint replacement. Total joint replacement is a safe and effective way to relieve pain, correct deformity, and help you resume normal activities. Successful total knee arthroplasty is directly dependent on reestablishment of normal lower extremity alignment, proper implant design and orientation, secure implant fixation, and adequate soft tissue balancing and stability. Instruments are designed to help the surgeon accomplish these goals by combining optimal alignment accuracy with a simple, straightforward technique. The center of the hip, knee, and ankle are restored to lie on a straight line. It is worth noting you will set off metal detectors with your new hardware. You do not need a card to travel. They are trained worldwide to recognize joint replacements, and they are usually more worried about a button on your jeans or a belt buckle. For those of you having a total hip replacement, the hip is one of the body's largest joints. It is a ball and socket joint. The socket is formed by the acetabulum, which is part of the large pelvis bone. The ball is the femoral head, which is the upper end of the femur or your thigh bone. The bone surfaces of the ball and socket are covered with articular cartilage, which is a smooth, slippery substance that protects and cushions the bones and enables them to move easily. The surface of the joint is covered by a thin lining called the synovium. In a healthy hip, the synovium produces a small amount of fluid that lubricates the cartilage and aids in movement. The total hip replacement is an excellent pain-relieving procedure. The way a surgeon gains access to the hip during hip replacement surgery is referred to as the approach. There are various types of approaches, named according to the direction that the surgery is performed. The approach your surgeon will use will either be anterior, which is done from the front of the hip, or posterior, which is done from the back of the hip. Depending on the approach your surgeon uses, it will determine the hip precautions you will follow after surgery. For anterior approach, no extending the surgical leg behind you and avoid rotating the foot out. No external rotation of the surgical leg or twisting of body over the leg. No sleeping or lying on your stomach or propping up on your elbows. For posterior approach, no going past a 90-degree angle. No crossing your legs and no turning your feet out or in. There are risks involved with any surgery. I would like to talk about a few of these things so you know what to look for to keep you safe when you return home. Although complications are relatively rare, patients may experience a complication in the postoperative period. Following a joint replacement surgery, blood clots are a possible complication. The risk of a blood clot with this type of surgery is 2 to 4%, and we will make every effort to minimize the chance that you develop a serious clot. The first thing we have you do is take a blood thinner, usually a low-dose aspirin, if you are not allergic, twice a day for 30 days after surgery. The next thing we want you to do are what we call ankle pumps. Those are big stretches with your feet and toes to promote blood flow while you are sitting in your chair or resting in your bed. This keeps the blood flowing just like you are up and walking. Ankle pumps are very important. If blood is moving, there is less chance for it to stay in one place and develop a clot. The next thing we want you to do is get up and walk. We want you up and moving 5 to 10 minutes every hour you are awake. Pick a long hall or a loop in the house and get up and move. Finally, we will send you home with some rechargeable compression boots that you will wear on both your calves for 2 weeks after surgery. These will give your calves a squeeze intermittently and promote blood flow just like you are up and walking. It is very important that you inform your surgeon if you have a history of blood clots. So what do you need to look for when we talk about a blood clot? Deep vein thrombosis, or a DVT, occurs when a blood clot forms in one or more of the deep veins in your body, usually in your legs. It can develop on either side, not just the side we have worked on. You will be watching for swelling in the affected leg, pain or tenderness in your leg, a feeling of increased warmth in the area of the leg that is swollen or painful, and red or discolored skin in the affected area. Remember, any question at all, you will call our Total Joint Care line. You may have heard of a blood clot breaking free and traveling to the lungs. This is called a pulmonary embolism. Symptoms of a pulmonary embolism tend to come on suddenly and most commonly include chest pain, shortness of breath, and cough. The risk of a pulmonary embolism with this type of surgery is less than 0.5%. Again, not to scare you, just want you to know what to look for to keep you safe when you get home. Bruising is normal after having your joint replaced. Bruising can be mild for some people, and others can bruise from the top of their leg to the bottom of their foot. It usually comes on around day 4 after your surgery and will usually begin to fade after about 2 weeks after your surgery. Infection is never good, but it can be catastrophic in a total joint surgery. We will take every measure to prevent infection, and we want you to know how to do the same. The risk of a postoperative infection in healthy patients after total joint surgery is very rare. This can occur as early as 5 to 7 days or as late as years after surgery. You will receive IV antibiotics immediately prior to surgery and another dose before leaving. If you notice increased pain, increased redness, increased swelling or tenderness at the wound site, increased drainage, pus or foul-smelling drainage, or a temperature over 101, we want you to notify your surgeon. Nerve injury. Damage to surrounding structures in the knee, including nerves, blood vessels, and ligaments, are extremely rare. Patients routinely notice numbness in the skin surrounding the incision as a result of cutting little sensory nerves when we do surgery. These are the ones that give you feeling, and they usually heal themselves, but may take time, even up to a year after surgery. If you notice a numb spot along your incision, it will not affect how your hip or knee works. Slow wound healing. Most wounds heal just fine. There are some things that can affect wound healing, including obesity, poor nutrition, smoking, and diabetes. I anticipate you will heal great. Limited range of motion. It is possible for your knee to be stiff after surgery. Some people have a difficult time getting full extension, that's the straightening, or full flexion, which is the bending. The best way to avoid this is by doing your physical therapy exercises. It is also important that you do not place a pillow under your knee for about 6 weeks after surgery. Keep your leg nice and straight by placing 1 to 2 pillows underneath your leg or ankle for elevation. The last thing is loosening of the joint. Maintaining ideal body weight and avoiding high impact activities, meaning anything where both feet leave the ground at the same time, are the best ways to prevent this. A new study shows that 85 to 90% of artificial joints are still intact and functional after 25 years. To reduce your risk of the things we just talked about, we want you to do all you can for yourself to make your surgery a success. If there is something you would like to work on to improve your health, please let me or your doctor know. There are many resources available and we would love to help. It is important that you keep your blood sugar levels under control and eat a healthy, high-fiber diet and drink a lot of water while your body is healing. We also encourage you to start doing the exercises in the book ahead of time to strengthen those muscles before surgery. The biggest cause of an infection from this type of surgery is from the bacteria you are carrying on your own body now. We want to do all of these things to decrease your bacterial count before you go in for surgery. The biggest way to prevent infection is with good hand washing and by keeping your incision clean and dry. We will talk more about your bandage at the end of this slideshow. No shaving your legs for 5 days before surgery, as this can create microscopic cuts in the skin and bacteria can enter. Start using a pump antibacterial soap in the shower for 2 weeks before surgery. Dial hand wash is the easiest to find, but there are some antibacterial body washes that are a little nicer to shower with. We don't like bars of soap during this period. Finally, you should have 3 packets of Hibiclens antiseptic skin cleanser in the back of your guidebook. Please read the instructions inserted before doing your special showers. Starting 2 days before your surgery, do your first double shower. What I mean by double shower is you will first use regular antibacterial soap on your entire body, wash your hair, rinse, and then using a clean, wet washcloth, turn the shower off, and starting from your neck down, wash your entire body, avoiding mucous membranes, but then spending 5 minutes on the area where we'll be working front and back. Do your second double shower the night before surgery, climbing into clean sheets afterwards, and then you will do your last double shower in the morning before you check in for surgery. This will further reduce the bacteria on your skin. Remember, no lotion, powder, perfume, or cologne after these special showers. There are some pretty common side effects from the narcotics you may be taking after surgery. I like to talk about these to try to avoid some of the side effects if possible. Constipation is a big one. There are many factors that can contribute to constipation, including pain medications, immobility, pain, and alterations in your food and fluid intake. You can end up more miserable from constipation than you ever thought of being from your joint replacement. There are several ways to avoid constipation. On top of drinking at least 6 to 8 glasses of water per day and increasing your fiber in your diet, you can add Metamucil 3 times a day. We recommend you take a stool softener and a laxative starting the night you get home. If you pick these items up, we will explain how to use them on the day of surgery. Nausea is another common side effect. The best thing you can do to avoid nausea is to eat before taking your medications, especially your pain medicine. Pick up some crackers or granola bars to keep on your bedside table, so in the middle of the night, if you need a pain medicine, you can eat something first. The other thing I see is people lose their appetite after surgery and don't eat. You need to push through that and eat small amounts more often, even if you're not hungry, to wake your system up. You'll feel a whole lot better than having all that stuff in your system and no food. You will receive a medication for nausea, so you will have that if you need it. Equipment for home use. The list of equipment is to help you when considering what you may need after surgery to assist you in your recovery. If you are unsure of your specific needs, your therapist can help you at your pre-op evaluation. Although you will soon be walking with ease, the first few weeks will be a little slow going. We encourage you to accident-proof your home. These things are all pretty self-explanatory, but I do like to remind people that they are very important. Make sure you clear a nice wide path to your bed, bathroom, and favorite chair. Get a sturdy walker with wheels on the front and a raised toilet seat. Some people like to have a shower seat as well. Also, make sure you have made arrangements for your pets before getting up. I think a lot of times we take it for granted how often we trip over our pets. If you have someone to help with meals or come to help relieve coach for a bit, take the help. Some patients have said they prefer more bland foods while taking pain meds, but there are no limitations on your diet. Your surgeon probably already ordered medical clearance, labs, and an EKG. It is very important to having your surgery that these things get done, so make sure to complete them as instructed. As one part of your surgeon's evaluation of your recovery after surgery, we will have you complete several online assessments at various intervals throughout your recovery. These assessments are designed to track your physical recovery and improvement to your overall quality of life. You will receive a text or email asking you to complete an online assessment and a link that you will click on to do so. It is important that you complete each assessment within a few days of being contacted. This allows your care team to have all the information they need to provide you with the best care possible. 10 days prior to surgery, we want you to stop all vitamins and herbal supplements, aspirin or blood thinners, diet medications, and anti-inflammatories. There are a lot of natural blood thinners and vitamins and herbal supplements. It is important that you stop these things listed 10 days prior to surgery unless otherwise instructed by your doctor. A quick countdown starting 2 days before your surgery. Remove all nail polish from your fingers and toes and do the first special shower using the cleanser. The day before surgery, we will call you with your check-in time and instructions. Do your second special shower. Remember, climb into clean sheets and don't use any lotion, powder, perfume, or cologne after your special showers. Pack an overnight bag. Come prepared to spend the night. Bring your medications and your CPAP, for example, if you have one. I've only had one person spend the night in the 5 years that I've been here, but we are always prepared. Wear clean, loose, comfortable clothing. It is a little bit of a bulky dressing. We do send you home with a sleeve that wraps around your hip or your knee that holds 2 gel ice packs, and we give you 2 extra to swap out. Remember, it is important that you are well hydrated before surgery. Drink 1 16-ounce bottle of Gatorade the evening before your surgery. You may drink up to 16 ounces of Gatorade the morning of your surgery. Make sure you are finished drinking when you leave for Willamette Surgery Center. Do not eat any food after midnight before your surgery. This will cause your surgery to be canceled. Do not drink any other liquids, smoke, chew gum or mints, or any chewing tobacco. Willamette Surgery Center will call you prior to surgery and clarify these instructions. Please note the information on this slide updates the information on page 13 in your guidebook. And finally, the day of surgery. Do your last special shower. We do ask that you dry your hair. You can brush your teeth. Try to stay nice and warm before coming to the surgery center. Leave valuables at home. No metal goes back to surgery, so it's safer at home than trying to keep track of in a plastic bag. Bring glass case, dentures case, and hearing aids if you have them. And we will remind you when we call you with your check-in time what medications we do or don't want you to take the morning of surgery. Due to the recent concerns regarding COVID-19, we will give you instructions on the check-in process and visitor information when we call you with your check-in time. You will begin in pre-op, where a nurse will ask you healthcare-related questions, take your vital signs, and start an IV. You will see your surgeon before surgery as well as your anesthesiologist to answer any questions you may have before going into surgery. Before your surgery, your anesthesiologist will discuss your medical history and determine the best plan for you. Be sure to inform them if you have ever had any problems or family history of problems with anesthesia. Our surgeons and anesthesiologists prefer regional anesthesia because data shows it can reduce complications and improve your recovery experience with less pain, less nausea, and less narcotic medication required. Your surgeon will put a strong local anesthetic called Exparel in the area where they are working at the end of your surgery. The Exparel will numb your surgical site for a day or two. It is important to remember it will be numb and that anything you do while it's numb, you may feel in a couple of days when the medicine wears off. I mention that so you don't overdo it during this time. Use the checklist in the back of the guidebook to help keep you on track. You will wake after surgery with a nurse caring for you. Your surgeon will let your coach know when you are finished. You will walk 40 feet before you ever go home. The amount of time you spend at the surgery center will depend on how quickly you recover. Please plan on the possibility of spending the night, but don't count on it. Most people are ready to go home about 3 to 4 hours after surgery. It is more about meeting goals than a time thing, but I'd like to give you some sense of how your day may look. I can't tell you that there will not be any pain after surgery, but I can tell you that we want to make sure it is manageable. Our goal is to keep it at a 3 or below on a scale of 1 to 10. The pain management program we have in place is one that works very well. You will get a pain med that will be for almost immediate relief, takes about 30 minutes to kick in. There will also be an anti-inflammatory and a medication for nausea if needed. The least amount of pain medication you need to stay comfortable enough to walk every hour you are awake and to do your stretches and exercises is the right amount. It is not a good time to tough it out and not want to move. We will go over your medications on the day of surgery and we will give you a spreadsheet to help you keep track of everything. You should come out of surgery with what's called an Aquacell dressing. Knee replacements will have an ACE wrap over the Aquacell to keep compression applied for the first 2 days after surgery. Your home health nurse will remove the ACE wrap and you may shower on post-op day 2. Total hips will come out with the bandage and can shower on day 2 as well. The dressing stays on for 7 days and you will remove this yourself 1 week after surgery. The only reason you would have to do anything with your Aquacell dressing before 7 days is if it were to bleed enough to compromise the border or if it becomes saturated. We would ask you to please call the Total Joint Care line if you have concerns about bleeding or drainage. Your surgeon may determine that you need a drain after surgery. If you get a Prevena dressing, we will go over special instructions. It remains in place for 7 days as well, but this one is not waterproof. When you get home, remember to go slowly. When getting up, make sure to sit up slowly, let your feet dangle for a couple of minutes before standing. If you feel dizzy, lie back down and try again after a couple of minutes. Reminder, go slow and do not get up by yourself for the first couple of days or longer if necessary. The goal of the rehabilitation period is to regain strength and movement in the hip or knee. It is important to avoid overworking or straining the hip or knee during this recovery period. You can usually resume normal activities within 3 to 6 weeks after surgery. After several months of rehab, you will be able to have a more active lifestyle. Let's review. The next 4 slides are a quick review of some of the information we have just covered. What would you tell your mother, daughter, son, etc. about what they could do if they had a question or concern regarding your recovery. You can call the Total Joint Care Line with a 24/7 answering service to get your message to the on-call provider. I want to be sure that I clearly described some of the steps you can take to prevent a blood clot. Can you think of 2 things you can do when you get home to get started? Remember, ankle pumps 20 to 30 times per hour, early ambulation, the aspirin or blood thinner you are prescribed, and the portable take-home compression device you will wear for 2 weeks after surgery. We have reviewed a lot today, and I want to make sure I explained things clearly. Can you tell me what signs of an infection you will be looking for? Mild redness of the incision after hip or knee replacement is normal. A temperature over 101 degrees is not normal after having your joint replaced. If you experience increased redness, warmth, or tenderness, and pus or foul-smelling drainage once home, you should notify your surgeon. We talked about 2 ways you can prevent nausea and what to do if you experience excessive nausea or vomiting. I want to make sure I explain these things clearly. Would you please take a minute and think about ways you will prevent nausea? We talked about the biggest way to prevent nausea is to eat before you take your medication and to eat smaller amounts more often. If you need pain medicine in the middle of the night, it is a good idea to keep some crackers or granola bars on your bedside table so you can get something in your stomach before taking your medicine. You will have a medication for nausea to take if needed. Always remember, if something is not working for you, please call, as there may be other things your surgeon may want to try. Finally, you are the key to our success. We are always open to feedback. Feedback is valuable information that will be used to make important decisions to improve our program. If you get a survey on top of all of the things you are doing to prepare for your surgery, we always appreciate it. Now you are ready for recovery. Thank you for taking the time to view this important information regarding your upcoming joint replacement. If you have any questions, please do not hesitate to call or email.